Are you concerned about the rising trends in chronic disease? Do you work in the primary healthcare sector? Physicians are increasingly encountering significant numbers of patients with one or more chronic diseases. Additionally, patients at risk of developing a chronic disease in the future are also on the rise. In this video, you will learn how to more effectively integrate green space concepts into primary healthcare practice. Multiple studies have been conducted on this topic, and the evidence supporting the health benefit of exposure to green spaces continue to accumulate. Green spaces can take many forms, including urban parks, community gardens, street trees, front and backyard, green roofs, and green walls among. Green spaces can be used in a variety of ways by different populations and can be especially valuable for counteracting the negative aspects of urban environment. Here is where you come in. As a healthcare professional, you can play a pivotal role in advocating for programs striving to preserve and expand urban green spaces that will foster the health and well-being of your patients. Research suggested that access to and regular utilization of neighborhood green space has significant physical and mental health benefits. Notably, these include reduction in morbidity and mortality associated with cardiovascular disease and chronic respiratory illness, strengthening of the immune system, enhanced ability to cope with asthma and allergic reaction in later life due to early life exposure to biodiverse environment that include commensal bacteria, virus, and pollens, decreased obesity and weight problem due to increased physical activity, relief from sleep disorder like insomnia, reduction of heat-related illness such as heat stroke and noise pollution. Green spaces can have tremendous benefit for individuals suffering from a range of mental disorder. Indeed, research evidence indicated that green space-related activity and exposure with nature causes reduction in the level of biomarkers such as salivary cortisol level associated with stress and anxiety-provoking situation or activities. Exposure to green space and nature, such as walking or engage in other physical activity in parks, have been associated with decreased number of attention deficit hyperactivity disorder in children. Why should you be concerned as healthcare provider? According to World Health Organization's report, chronic diseases are the leading cause of death. Globally, if the current trends continue, it will also be the leading cause of disability by 2020. As a result, most doctors who want to care their patient, they end up spending significant amount of their time caring patient for whom no cure is possible. How do we face this challenge? It's not an easy or clear path, but active collaboration among physicians and other healthcare providers will be essential. Another important step will be the introduction of new concepts into the healthcare practice that emphasize the importance of green space exposure in both prevention and cure-based therapy to mitigate risk factors. Green space concepts in a healthcare setting have very broad application and can differ from one geographical region to another. Aspects such as region, culture, and ethnicity should be also considered. We can narrow it down to two main ideas. One is green prescription and another is green exercises. What is a green prescription? Green prescription is a health professional's written advice to a patient to be physically active as part of the patient's health management. In fact, results from a randomized controlled trial shows that a written prescription is a more effective approach than just verbal advice from a primary healthcare practitioner. One important factor to consider in this context is the role of power dynamics in the physician-patient relationship, especially when a written prescription is involved. What is green exercise? Green exercise, defined as physical activities undertaken in a green or natural environment. Studies have proven that exercise in a park or other similar natural environment is more beneficial than exercise in an urban environment. Therefore, a written green prescription that includes green exercise can be a particularly effective approach for helping improve your patient's health and well-being. Such a prescription will be biking, hiking, to simply walking or relaxation in nature. Just like medication-based prescription, a green prescription will be based on clinical practice guidelines, utilize available community resources, and engage other supportive green healthcare providers in addition to the physicians. Regular follow-up to ensure compliances and patient progress is vital as well. Here are some great examples of green prescriptions by healthcare providers. Mudu P is a province-wide initiative in Ontario by Canadian Mental Health Association for people who are experiencing or at risk for mental health problems. Park prescription, a coalition of physicians, health insurance companies, naturalists, government agencies who are working together to help people engage in outdoor activities in park or other green spaces. This initiative has been adopted by a group of family physicians in some part of USA to effectively reduce sedentary lifestyle among adults and children. Study shows that viewing green or nature through hospital windows associated with quicker recovery for surgical patients. Nature-based therapy such as community gardening has been a beneficial approach for elderly people living in nursing homes. Shinrin Yoko, or forest bathing, was developed in Japan during the 1980s and has become an essential part of preventive healthcare and healing in Japanese medicine. Although the health benefits of green space are well known, therapeutic application of green space in healthcare is not well established. Some common challenges addressed by Vandenberg et al. Are inconsistent terminology and language to describe the field or classify the interventions, insufficient linkage among green space activities related service provider and healthcare professionals. Healthcare professionals do not have clear clinical guidelines on how to refer their patient to these services or how to access these services. For example, inclusion of eco-health concepts related to green space in clinical practice guidelines may play a key role in increasing green prescription by healthcare providers. Another challenge is interventions related to green space usually take place in natural surroundings instead of standard healthcare environment. Randomized controlled trials are not well suited for evaluating the effectiveness of nature-based intervention, which means that results from research studies on this topic are unlikely to establish a sufficient scientific evidence base for convincing healthcare professionals to incorporate more green prescription into their clinical practices. Nevertheless, considering the wide-ranging scope of health benefit associated with green space exposure, it is imminent that primary healthcare practitioners and professionals working in conservation, public health, policy planning, education, and other sectors must collaborate to mitigate these challenges. Incorporate green prescription into your routine clinical practices and join us in bringing about a greener and healthier future. Find out more on our website. Thank you.